occupational therapy student. I'll be working with you today.
Oh, I already had therapy yesterday.
Yeah.
Occupational, that's different. What do you do?
So occupational therapists work with our clients to help them in getting back to doing the things that are meaningful to them. So we call these things occupations. And here in acute care, we focus on your activities of daily living, which are, toileting, bathing, hygiene, and stabilizing, making sure that you are ready to go on to the next point of care.
Okay.
All right, so today, what I'd like to do is to get you out of bed, into your wheelchair, so that we can go do some bathroom ADLs, brushing your teeth, combing your hair, getting you ready for the day.
Okay, let's do it.
Okay, but before we get moving, I see in your chart you had a posterior right total hip replacement.
Yes.
So, yes, you did. And the posterior approach, I'm so sorry. Posterior approach right hip replacement. Do you know what that means?
Nope. They changed something in my hip.
Yep, they replaced the hip and the hip joint inside the socket. So we want to make sure that stays in the socket, and it's a posterior approach. They went through the back, and they gave you 3 hip precautions. Do you know the hip precautions?
No.
Okay, so I can tell you about them because we want to make sure we maintain those hip precautions and we don't break them, because it could cause the hip to come out of the socket and then you'd have to go back to surgery. So let's talk about those 3 and how we can move around safely with them. So the first one is no bending past 90 degrees. That means if you were to take your torso and your leg and to bring it up into this L shape, that makes a 90 degrees. And you don't want to go past that. So when you go down to tie your shoes, you break that 90 degrees. If you were to bring your leg upwards, that would break the 90 degrees. So certain positions we want to avoid.
Okay.
So just remember, no breaking that L 90 degrees. The other one is no crossing that side over the other side. So we call that crossing the midline. If you were to draw that line down your middle, and if you were to cross it, that could cause the hip to come out of place.
Okay.
And also turning inward. So that's the third one. So if you were to bring your hip or your knee or your toe inward, that can cause some damage to the surgical side. Okay, so you think you could tell me those in your own words?
Yeah. The L shape, I can bend or lift my legs, so don't break the 90 degree. The middle one, I can't cross that line, so I can move my leg. And the other one, I can move my knee or my hip. Rotating it.
Yeah, internal rotation, turning it.
Okay. Yes.
Okay, and do you know about your weight bearing status?
And he said something, but I can't remember. I think that I think. No.
Yeah, you can put pressure on the leg. It's weight bearing as tolerated, which means that you can step on it until you feel pain or discomfort. Then you want to, relieve that pain and kind of maybe just lightly step on it or take a seat and rest. Okay.
All right.
Are you ready to get moving?
Yes, let's get out of bed.
Okay, before we get moving though, I do want to tell you the steps and how we're going to do this, because it is a lot of different steps and we're going to take it nice and slow. The first thing I'm going to ask you to do is you're going to bring up the opposite side, your left side, and you're going to bring it up to a knee position. And with that, you're going to lift your hips a little bit and scoot yourself just a tiny bit to the edge. And then your body, your upper body, we're going to come up to our elbows and then push to our hands, so that we're not breaking that L. You don't want to bring your hands too close, because then you will sit in that 90 degrees. So you want to keep your hands behind you, and you're going to rotate to your right towards that big pillow, and we're going to slowly get you to the edge, and then you're going to drop your legs down. Your surgical side, you always want to keep it extended out so that you can keep your hands back and kind of stay in this position. And then when you're sitting up, you're going to push off the bed and grab onto your walker. And you can put your foot down at this point because you are toe touch or weight bearing as tolerated. And then to get to the chair, we don't want to turn or cross. So we're going to use small steps forward, and then you're going to slowly pivot and turn back. Making sure you keep your wheelchair all the way back and seated. And when you sit down, you're not gonna sit like you regularly would. You always wanna kick that surgical side forward and then down. Okay, just like when we're sitting at the chair, that's how you'll sit and that's how you'll stand back up. Any questions?
All right, we'll try it.
We'll try it. Any pain?
A little bit, but I took some pills this morning, so.
From a 1 to 10, where would you put your pain? 1 being nothing, little bit, 10 being severely in pain.
Like 5.
5.
Or not.
Okay. All right. Well, let me know if that pain increases. Okay. You
Okay.
did take your medication,
This
correct?
morning, yes.
This morning. Okay. A little bit kicking in real soon.
Okay.
Okay. Now, let's start with that first part. So we're gonna bring this opposite leg up. Yep. And can you lift with your hips just a little bit over? Perfect. I'm gonna stay on this side the whole time. You're gonna push through your elbows to prop up your shoulders and chest. Now to your hands, perfect. And now we're gonna slowly turn. Okay, and you
Both
gotta
arms?
move.
Both legs?
Yep, bring your legs, bring your upper body as well. Turning, yep. Turning, okay. Okay. So don't get to scoot your bottom forward, so you're right at the edge. How does that feel?
Good.
Any dizziness or discomfort?
A little dizzy.
Okay, let me check your pressure. Check your blood pressure. Okay, maybe let's just wait a second before we get moving.
Okay.
Take a nice deep
Right
breath. Okay. All right,
Okay.
make sure we're not crossing that 90. You're gonna keep that leg out. That's great. So this is the position we want you sitting in so that you don't break that 90-degree angle that we were talking about. I'm gonna get your gait belt. And this is used for safety and so I can help you stand up. Okay, so we're gonna push from our hands and we are going to push through our leg as well to stand up, okay? Because this one, you just wanna put a little bit of pressure. Okay, are you ready?
Mm-hmm.
1, 2, 3, push up. Okay. Now hold on to your walker, hands on your walker. Okay, and now we're going to walk forward, small steps, make sure we're not crossing. You can put your foot completely down.
Okay.
Small steps forward. Good. Now we're gonna pivot,
What's pivot means?
like turn, without keeping this leg straight. It's just a small turn. Okay, great. Now we're gonna walk backwards. Okay, stop. You feel it behind your legs?
Yes.
Okay, so now with your hands, you're gonna reach back for the arms on the chair. Don't exist. Keep your leg out forward, the surgical side, and now we're gonna lean you down. Okay.
Okay.
How was that? How do you feel?
Good. Good. Okay. This was easier than I thought. Well, harder than I thought, actually.
A little hard, yeah, but that's how we're practicing.
Okay.
Hey, great job.
Thank you, Christy.
You're welcome.